as head of the school health program at the Department of Health. From there, moved to Baltimore as Commissioner of Health, and then back to New York City as First Deputy. And then last December, Mayor de Blasio named her as Commissioner of the Department of Health. At the time when she accepted, she named priorities, which she said were racially based health inequities, including the opiate overdose epidemic, HIV, maternal and child health. But like so much in government, the priorities come surprisingly through the window, and measles and vaccination became a high priority. I'm sure her first three are much in her mind. She has navigated with great focus and strength the measles and vaccination issues. We're delighted to bring to this podium Commissioner Barbot.
Good morning, everyone. Good morning. Excellent. I'm a little bit height challenged, so we use a stool, but now I feel like I'm towering. So thank you for that kind invitation, and it's a pleasure to be with you this morning to talk about a topic that honestly I never anticipated would have taken up so much of my early tenure as health commissioner, and would have given me the distinction of being sued in my first 3.5 months in official office. But before jumping into my remarks, I want to first thank Professor Sandler and Dean Crowell for their kind invitation and for the opportunity to speak before an audience that I don't think I've ever spoken before, an audience with so many lawyers. And I'm excited about that because obviously I am not a lawyer, but I use the law every single day, and it's an incredibly powerful tool that helps us keep New Yorkers safe every single day. So I'm excited to be here to share with you our experiences in the 2018-2019 measles outbreak. So let me start at the beginning. October 2018 was the beginning of what has been an 11-month journey and exercise in balancing the health department's fundamental belief in individual rights while holding people accountable to the greater good. It has also been instructive to me about how New Yorkers and those beyond trust or don't trust government, what their faith or lack of faith is in the medical system, and an underlying sort of basic belief or not in what many consider to be simple facts. And so it's been an incredible journey and learning what we have taken for granted and what we need to fight for every single day. All of these factors are ones that we regularly struggle with in public health, though not usually at such high decibels or on such a large scale or at the same time. So we were dealing with all of this at the same time. My remarks are going to cover the public health measures that we operationalized during the response. I will talk about some of the legal actions that were taken, and then talk about some of the unique challenges that we confronted along the way. And I intend to do this in 20 minutes so we can leave lots of time for question and answers. So let me start off by talking broadly the approach that we took. It was a phased approach that we, for lack of a better term, we fought on two fronts. The first front was a communicable disease front, and the second front was that of misinformation, lies, and fear. So I'm going to talk about the communicable disease front first, and then I'll talk about the communications aspect later. So as a health department, we recognize that the powers at our disposal for fighting health crises are considerable, and we don't take that responsibility lightly. The measles outbreak provided us with ample decision points that forced us to consider which powers to exercise and when, and for how long. Our response at every step was therefore incremental to meet the risk at hand. We didn't exercise the most aggressive approach until the data was clear that more extreme measures were called for in order to abate community-wide transmission of measles. So in response to the first cases last October, schools were required to exclude non-vaccinated or exempted students where there were known persons exposed to the virus. And this was pursuant to New York State Public Health Law 2164. Our standard practices made enforcement of excluding students who were unvaccinated against measles seamless, because schools are required to have complete vaccination for all enrolled students on site, and if they can't, they're at risk for fines. Indeed, over the course of the response, there were 12 schools that had to be closed and eventually reopened because of non-compliance. But this approach didn't quite get us where we needed to be, and with case counts rising, we knew that this baseline approach wasn't going to cut it and we had to do more. In early December, we issued exclusion orders in communities with ongoing transmission to exclude non-vaccinated students. What this did for us was reduce the amount of time between infraction and violation. The fines against schools not excluding non-vaccinated students were extended to all schools in communities with ongoing transmission, even those schools where there was no documented transmission. So first one was only if there was transmission in a particular school. Second one was if there was transmission in a community where schools were not excluding. So even if you had no students that had measles and you were not following the rules, you were at risk for fining. And so what this helped us to do was slow transmission in schools. But what it didn't address was everything else that we were facing. So we received anecdotal reports of quote-unquote measles parties. And by the middle of March, cases were rising fast. And so this idea of measles parties was very concerning to us, because for those of you who are my age or older, you may recall that, back in the day, our parents would hold parties so that we would be exposed to measles, to chicken pox, to whatever the communicable disease of the day was, so that we could get it over with and go back to school. What I have been saying recently, and especially as a result of this outbreak, is that we live in a much different world than back in the day. There are many more, thankfully, because of medical advances, many more individuals, many more children that are surviving with cancer, that are surviving with immunocompromising diseases and going to school. And so this lack of vaccination puts not only those children at risk, but other individuals in the community who are ineligible for vaccination. And so practices of the past cannot apply to the present. And so we knew that because of these measles parties and because of ongoing transmission, the situation called for more extreme measures in light of the potential health consequences of measles. Measles kills about 1 in every 1,000 individuals who gets the infection. And it is something that on a day-to-day basis I would go to sleep every night thinking, who's going to be the next person infected by this, and are we going to see a death? And we could not take those chances of having individuals really be exposed to an illness that was not as benign as anti-vaxxers would have community members believe. So drastic action was needed, and we turned to the powers that stem from Jacobson v. Massachusetts, which I'll talk about momentarily. That's where I get to play a little bit of a lawyer. On April 9th, we declared a public health emergency, a rarely used tool that the agency has in its regulatory arsenal. And this public health emergency ordered adults and children living in the affected zip codes in Williamsburg to be vaccinated within 48 hours of the order going into effect. The emergency order is authorized by the Board of Health and the department's power to, 1, control disease pursuant to Section 556 of the New York City Charter, 2, abate dangerous conditions within city limits pursuant to New York City Administrative Code 17-142. And I use my authority per Section 3.01 of the New York City Health Code to declare a public health emergency and order mandatory vaccinations against measles. And so let me just sort of take a little bit of an aside to talk more in depth about Jacobson v. Massachusetts. The balance between civil liberties and civic accountability was first tested in 1905 in the U.S. Supreme Court case Jacobson v. Massachusetts. From 1901 to 1903, Boston was in the middle of a major smallpox outbreak, affecting over 1,500 individuals and killing 297. In 1902, after the Cambridge, and as I was reading this, I was like, oh, there are so many similarities here. In 1902, after the Cambridge Board of Health required all adults to be vaccinated against the smallpox, Henning Jacobson, a Massachusetts pastor, refused to vaccinate himself or his son, claiming they had experienced adverse reactions to other vaccinations. He was fined $5, which in today's dollars is about $140, for refusing to vaccinate himself and his son. He appealed his case to the U.S. Supreme Court, claiming mandatory vaccinations violated his 14th Amendment rights. Fortunately for public health, the court ruled against him in a 7-2 decision and upheld the Cambridge Board of Health's authority to require smallpox vaccinations during an outbreak, and confirmed that mandatory vaccinations, in fact, did not violate one's constitutional rights. However, Associate Justice John Marshall Harlan did acknowledge that requiring vaccinations would be cruel and inhumane for certain individuals, thus creating medical exemption under Massachusetts public health law. The court's landmark decision clarified that individual liberties must sometimes be curtailed for the common welfare and are subject to the police powers of the state. And since 1905, this case law has provided state and local boards of health across the country authority to mandate vaccinations. Now back to modern day New York City. Our emergency public health order stated that if a person living in 4 zip codes in Williamsburg was linked to a case of measles and was unable to show proof of vaccination or immunity, they were at risk for violations and fines. The order was not implemented to penalize individuals, but instead increase the urgency for getting immunized and make it easy for them to do so. Less than a week after the order was issued, a lawsuit was filed in State Supreme Court in Kings County by 5 anonymous parents. The plaintiffs accused the agency of failing to A, use the least restrictive means to control the outbreak, B, obtain informed consent and allow free exercise of religion, and C, violated their children's lawful exemptions from vaccination based on religious beliefs. The lawsuit included 3 components: temporary restraining order of the emergency order, preliminary injunction, and motion to vacate the city's order. The temporary restraining order was denied the same day the lawsuit was filed. And on April 18th, Supreme Court Justice Lawrence Nykel upheld my order on grounds that a measles epidemic was indeed occurring in Williamsburg. In his decision, he stated the pivotal question posed for this court's determination is whether respondent commissioner has a rational, non-pretextual basis for declaring a public health emergency and issuing attendant orders challenged herein. The evidence in this regard is largely uncontroverted. Beyond that, he said, A fireman need not obtain the informed consent of the owner before extinguishing a house fire. Vaccination is known to extinguish the fire of contagion. Of course, our response didn't end with just the emergency powers, but drew on the considerable resources from across the department. At the end of the day, and that day was this past Tuesday when we declared the outbreak over, we deployed 547 health department staff for over 104,000 hours of work to track down over 21,000 individuals who were exposed to measles and confirm their immunization status, as well as determining whether or not they were symptomatic. And our staff fully investigated over 2,000 suspected cases of measles, along with a concerted and sustained public health education campaign on the safety and efficacy of the measles vaccine that leveraged trusted community voices in the ultra-Orthodox Jewish community. All told, we spent $6 million to end the outbreak. These resources allowed us to declare an end to the outbreak after 11 months, and with a final count of 654 individuals affected and not a single death, thankfully. The challenge ahead for us remains, and that challenge is fighting vaccine hesitancy. Our outbreak didn't happen in a vacuum. As you know, there were several smaller but no less vexing outbreaks across New York State, as well as the rest of the country and many parts of the world. The common thread that spans communities across different continents, was measles susceptibility because of the vaccine hesitancy. European nations, including France, Germany, Italy, Poland, Romania, Switzerland, and Ukraine, saw vaccination rates dip below 80% in the last several years, which jeopardizes herd immunity, an important epidemiological phenomenon that protects those who cannot receive immunizations. The World Health Organization declared vaccine hesitancy as one of the top 10 threats to global health in 2019, along with obesity, climate change and air pollution, and Ebola. The reality is that anti-vaxxers are manipulating public opinion in lieu of facts, and they are jeopardizing community and international health. They are targeting certain communities, and in this city, primarily Brooklyn, with false claims that the measles vaccine is unsafe, causes autism, and autoimmune disorders. They are adept at using strategies from anonymous robocalls to transmitting false information through the web with impunity because they have no one to hold them accountable for misinformation. These shadow tactics show a callous disregard for every person who is unable to get immunized, such as newborns, people who are pregnant, and those who are immunocompromised. And as the health department, we were compelled to act because contrary to what the anti-vaccine messages are, measles is not without consequences, not the least of which is the possibility of death. The educational efforts that have been mobilized in the city, across the state, and throughout the nation to combat anti-vaccine messages have given renewed attention to the importance of vaccines. I think the important thing to note here is that it was clear that our message couldn't be delivered solely by a government entity. We needed to leverage trusted community voices. And to a large extent, I think that this particular component is what distinguished response to this outbreak from all other responses that I've been involved with through my work in the city. And that is that we relied heavily on trusted community voices to deliver the messages that we put together. So for example, we had an organization called the Jewish Orthodox Women's Medical Association, which didn't exist before this outbreak, but community members took it upon themselves to create these organizations and take on the fight, the hand-to-hand combat against the fear and lies propagated by the anti-vaccine movement. And additionally, we leverage trusted voices in the religious community to, again, provide parents with the most accurate information to make them feel good about vaccinating their children, because though we were dealing with this outbreak now, this is an issue, vaccine hesitancy, that can rear its ugly head at any moment. And it's not just about the outbreak at hand, but it's really putting in measures that will continue to protect and promote the health of all New Yorkers for generations to come. And so, in this struggle of countering misinformation, we have opened opportunities to identify and remove mechanisms such as religious exemptions that have been exploited by anti-vaxxers. There is no religious canon that says, "Thou shalt not vaccinate." And I am extremely pleased that on June 13th, the New York State joined Arizona, California, Maine, Mississippi, and West Virginia in the removal of religious exemptions from compulsory vaccinations of children. And I have to pause because as I was putting these remarks together, I thought to myself, in what other context would all of those states be in the same sentence? But I will take it. We will be aggressively enforcing that change, but our efforts won't stop there. We will continue to review the lessons we've learned over the last 11 months to respond even more aggressively in the future. While this certainly goes beyond today's conversation, I also think that there are broader social drifts that are worthy of attention. First, an alarming disregard for fact-based information, even when that willful ignorance can kill you or someone you love. Second, the dangerous spread of information from online communities that reject medical science in favor of fear and lies. But regardless of its source, vaccine hesitancy is real and poses a dangerous global threat with the potential of reversing decades of progress we have made in eradicating preventable diseases. We must acknowledge that for the foreseeable future, balancing civil liberties and civic accountability will necessitate fully addressing fears parents and caregivers may have around vaccinating their children. In our most recent New York City Health Opinion poll conducted this year, 21% of respondents with children from birth to 17 years of age reported delaying or refusing to vaccinate their children. When you combine this sobering statistic with ongoing domestic and international outbreaks of measles, it is clear that our work is far from over. The threat from measles persists, and we must remain focused on maximizing the number of New Yorkers that are up to date on all of their vaccinations, because though the outbreak is over, there is still ongoing transmission of fears and lies about vaccines. We believe strongly in the rights of everyone to make an informed decision about their own health and the health of their families. Yet we are bound by the notion in our democracy that the responsibility to protect the well-being of the public extends to every person. We still need the support of everyday New Yorkers and community partners in spreading the truth about vaccines and making sure they and their loved ones are vaccinated. The work of the Health Department in balancing civil liberties and civic responsibility continues, and I am excited and committed to remain at the helm, taking on the fight and ensuring the health and well-being of all New Yorkers. So I will end there and open for questions.
We have two microphones, and we invite people who would like to make a short comment or a question.
My name is Ken Brown. I am the District Manager of Bronx Community Board 5. There are a number of health-related concerns in our community. We recently were rezoned we had one of the largest neighborhood-wide rezonings in New York City that was passed last March. And one of the commitments as a consequence of that rezoning was a public health task force addressing the social determinants of health. And one of the things that I think is intersectional in discussing anti-vaccination fears and the intractability of some of the social determinants of health is the relative lack of scientific skepticism that's taught in schools and abroad in the culture. There's a lot of arguments from authority. And it seems to me that in addressing anti-vaccination concerns and public health outreach in general, a lot of the advertising or a lot of the outreach is predicated on the argument of authority. This is the Department of Health, this is what we say to do, so you should do it on the basis of our reputation. So I guess my question is, what is the responsibility of the department in inculcating scientific skepticism abroad in the culture?
That was a question that we put to ourselves, because the way in which this agency has functioned in the past is very much what you put forward in terms of, we are the authority, this is what you need to do. And we will continue to do that. However, there are opportunities and incidents where we need to broaden that approach. And this particular outbreak was one in which we relied very heavily on community members answering questions for themselves, but doing so with accurate data. And I think that having conversations that question why we continue to do things the way that they've been done, why we continue to require, for example, vaccinations, is healthy, because having in-depth conversations about the pros and cons and the consequences of not being vaccinated, I think creates an opportunity for individuals and communities to be even more invested in their health and to come at the topic from an asset base as opposed to being told what to do. And I think, more broadly, it's an approach that we are interested in applying for a number of different epidemics, if you will, that continue to plague not only this city but the country in terms of opioids, in terms of HIV. We need individuals to be invested not only in their personal health, but I think this outbreak demonstrated the importance of not just thinking about one's own health, but thinking about the health of the community, and the fact that we are all interdependent, and that as a city, we're only as healthy as our most challenged community. So thank you for that question.
Roger Adler, two questions unrelated. First, a related question. New York City educates a significant number of the children of undocumented aliens. How much of a challenge is it to keep New York City healthy when many come from medically challenged areas to the United States looking for a better way of life, but may not have had vaccinations and so on in their home countries that they have immigrated from? Second question, which is discretionary at your call, is vapors, cigarette vaping. Is this something that's within your department's jurisdiction? Is there any contemplation that New York City, under your leadership, might regulate the selling of vapor cigarettes to minors under the age of 21? Thank you.
On a daily basis, it seems like we are under attack, and especially our immigrant New Yorkers are under attack. And our administration, under the leadership of Mayor de Blasio, has been very clear that we will continue to ensure that all city services are applied equally to all individuals, and that we will do anything and everything that we can to ensure that that doesn't change. We, with regards to sort of centering that then for measles, This outbreak was predominantly centered in a religious community that is not typically thought of as an immigrant community, but that certainly travels internationally. And the outbreak began with an individual traveling to Israel, coming back after exposure, and then sort of setting off this cascade. That being said, one of the things that really has protected the city in having this outbreak not be bigger than it was is the fact that when we look at children of school age, there is a 99.5% coverage of children. And that is because of the fact that we have redundant systems in place to ensure that individuals who are uninsured, individuals who may be undocumented and have limited access to care have places to go. And so we are fortunate in this city to have a jewel such as health and hospitals where immigrants, regardless of their status, can receive care. Additionally, through our immunization clinic, we covered a significant amount of the city. And in this particular outbreak, what we have seen is that over 112,000 people were immunized against measles, and this is a 27% increase as compared to the previous year. In terms of your second question regarding vaping, I think that this is a major concern for us, and we are excited that there is a bill before City Council for consideration, and we are looking forward to working with them to protect and promote the health of New Yorkers. I am very concerned that this is an example of how the industry has gotten ahead of regulation, and the fact that, you know, though Big Tobacco is labeling e-cigarettes as a smoking cessation device, the reality is that it's yet another way in which they lure young individuals to start their lifelong nicotine addiction. And we are committed, working with our partners and community, to do everything that we can to assure that we minimize this risk to New York youth. Yes.
Hi, my name is Ashwini Hardikar. I'm from Callan Lord Community Health Center. And we at times see HIV skepticism among people who have tested positive and don't want to be on treatment. And it does seem to, a lot of the skepticism does seem to come from patients who are in groups that historically have been abused or mistreated by the medical system. And so my question is, how can service providers both acknowledge the very real injustices that have happened to people at the hands of medicine throughout history, while also helping patients be educated about the importance of things like medication, vaccinations, and other evidence and science-based interventions?
Thank you for that question. The department, I'm trying to think how long ago it was, either a year or two ago, released the LGBTQ Bill of Rights and engaged the provider community in ways in which we can assure that individuals seeking care do so in environments that are non-stigmatizing, and beyond that are nurturing and supportive. We have a long way to go in that regard as a city, but I think the fact that through our website and through the LGBTQ Bill of Rights and the education that we're doing with providers, we have a growing list of providers that community members feel more comfortable in attending. That being said, the ultimate, I think, indicator of how well we're doing with regards to ensuring that individuals get to treatment quickly and stay on treatment, because we believe strongly in U equals U, right? Undetectable is untransmissible. So We are paying close attention to health systems and how they are doing and with regards to the HIV cascade, and we are reaching out to them to make available training on doing bias training, as well as how they can more effectively implement the LGBTQ Bill of Rights in their practices. So thank you for that.
Morning, Commissioner. I'm Howard Euro. This is a question more about process than about the substance of the discussion. I would probably come out with the majority in Jacobson. But in legal reasoning, not only the Anglo-American tradition, but globally, there's always another side of the issue. Every coin has another side. Every coin. Unfortunately, this forum this format doesn't allow for this kind of debate or discussion. But if you were to play the devil's advocate for a second, is there any merit whatsoever to the other sides, to any of the other side's arguments?
And by the other side, I presume you mean the anti-vaccine? I think I would answer in the affirmative if I trusted that they were dealing in accurate facts. And the fact that they knowingly perpetuate misinformation that has been debunked, such as measles causing autism, measles causing immune disorders, it makes it very challenging to tease out what merit there might be. Other than what I said earlier, there's always merit in fact-based discussions about why we're doing something so that individuals can feel grounded in their decision and positive about their decision. But until that time, I think it's challenging to have a conversation on equal footing.
Let me just jump in a second about the format. We do debates, but one of the things that I like about the breakfast format that we follow is it gives a person like the Commissioner an opportunity to give a talk like she gave today, which was a full description of her policies and progress in a particular subject matter without being attacked, without having to defend and back and forth. And there are many forums where you do have that kind of debate. But I think the idea of having a forum that says, come and tell us your program and explain it so at length, so we get it, is one of the choice we made here with this. But I agree with you. There are plenty of places, and there should be, for a real debate.
Yes, Commissioner. I'm James Baca. I'm a former New York City councilor, and I'm representing New York Edge Sports and Arts Foundation today. I'm also a distinguished lecturer now at Queens College in the Urban Studies Department. I can remember well when Mayor Bloomberg proposed a limited or controversial plan to restrict the use of soda. And the health department promulgated those regulations, and those regulations were then challenged in court by the soda industry. The court ruled that the health department lacked jurisdiction, and only the changes that the mayor was proposing could only be enacted by the city council. Since that time, nothing has happened in the city council. Nothing that I'm aware of has happened administratively. Yet we continue to see reports every day, including this morning where another report was issued, that show us the danger of excessive or continued use of high sugar products. What are we proposing to do? What are we doing? Is this issue has been on the back burner? Is the executive branch waiting for the legislative branch, or have we given up hope of doing anything administratively should the legislative branch not act? But it's an issue of major health concern, I feel, in our city.
I agree that big sugar is a big problem. And we recently, and again, I'm terrible with like time frames, but recently, I believe within the last 8 months, issued voluntary guidelines along with the industry. So we based our initiative, we had previously in, I believe it was like 2009, developed the National Salt Reduction Initiative, where we worked with the food industry to reduce the salt content in prepared food, industrial produced food. And we have built on that framework to engage industry in reducing the sugar content in prepared food, industrially prepared food. And we have been in ongoing collaborative discussions with them over the last several months. And I anticipate that in the next couple of months, we will be able to make some additional announcements about what we as the New York City Health Department are doing to continue tackling the issues of that big sugar is imposing on our communities and the health impacts of that. So thank you for that question and stay tuned.
Yes, my name is Angelo Kopsky. I'm an attorney in private practice, and I used to be involved with community organizations a long time ago. By the way, just on this sugar thing, before I ask my question, wouldn't it be possible to measure the what do I call it, the density of the sugar, the way they when somebody's a drunk driver, they measure the degree of alcohol in their blood, so that instead of saying I don't like a 32-ounce cup of soda, you could say I don't want anything that has more than 2% of sugar or some other measurement. Anyway, my question is, you certainly have done a very good job tackling measles. Are there any other diseases right now, communicable diseases, that are preventable by vaccination programs that you are looking at campaigning against, such as mumps?
So I'll take the first question first on the sugar, just to kind of close the loop. Part of the guidelines that we came out with did actually look at sugar density as well as overall sugar content, because it's about, if you look at the normal distribution curve in terms of sugar content, it's about reducing the density and reducing the content. So thank you for that opportunity to clarify. In terms of other vaccine preventable illnesses, we have a very robust immunization program, and as I mentioned, our school kids, 1.1 million of them, have a 99.5% immunization coverage. That's better than any other city in the country. And that's probably, bigger than some cities in the country. It's certainly more people than were in Baltimore, where I was previously commissioner. I think right now, in terms of the way that I'm framing my priorities is sort of the bread and butter of public health and how it is that we parcel out epidemics from sort of non-epidemics and rethinking what we mean when we talk about an epidemic, right? So this issue of opioids, I don't think that we would have, I certainly 5 years ago would have thought that we would be in a situation where we would still be in an epidemic situation. Thankfully, recently we have bent the curve in terms of the number of New Yorkers that die every day because of an opioid overdose, but I think we have more to do on that, and our momentum is gaining. The other aspect of epidemics are those epidemics that are slow burning, right? We have brush fires, which was measles, and then we have slow burning epidemics. And in my mind, the issue of trauma and how trauma is underlying a lot of the disparities in health outcomes that we see is a job that we as the health department need to take on more intentionally. And part of what we have already started doing is more fully integrating mental health into all of the public health work that we do, which is an area that, again, I think we will be leading in as compared to the rest of the country. So thank you for that question.
Commissioner, you mentioned the word epidemic, just very briefly. There's an old joke that if you sneeze, someone says Gesundheit. If you sneeze again, they say Gesundheit. If you sneeze a third time, they say epidemic.
My name is Robert Krakow. Thank you for so well articulating your views. I'm the lawyer who sued you. So I don't want to disturb the forum, and I think it's a great forum. But I have a few questions. I just want to warn you, anything you say can be used against you. First, I want to throw out a fact, and the fact doesn't come from me. It comes from a federal district court judge who reported that 35 years ago, in the hearings underlying the Vaccine Injury Compensation Program, it was reported with good information that there are 20,000 serious vaccine injuries every year, and that was a time when the vaccine schedule was probably 1/3 of what it is today. So it's reasonable to say that there are 40,000 every year. If I said that on the internet, you probably would say that's misinformation, and you'd probably call me an anti-vaxxer, which I'm not. And I want to know first how you would respond to that statistic. Would you just call it misinformation, or would you respond to it and deal with it? And that leads me to two other points, and I won't be that long. How do you deal with the issue of trust? The families I represent, not just here, but hundreds of families in the Vaccine Injury Compensation Program who have serious injuries, autoimmune injuries, from not only the measles vaccine, but the influenza vaccine. How do you gain their trust when they have been seriously injured? And there are doctors who are crippled or in wheelchairs from vaccines. How do you address those issues? Very serious issues. One more point.
Those are two very good questions, and let her address them because we have other people standing. So can we stop there, please, and go forward with those two very good questions?
So the issue of trust, I think, is central to what we are seeing, and the underlying reasons for that, I think, are complex, and I probably couldn't cover all of them. But I've covered a part of it, which is individuals spreading misinformation on the internet and having that take on a life of its own. One of the things that I didn't talk about, which I think contributes to misinformation and lack of trust, which actually was brought up by a community member from the Orthodox community that was on a panel with me. We did a presentation, I think it was at Mount Sinai or NYU. And she brought up the point that these days, doctors spend relatively little time with patients talking about their concerns. The way in which medical practice has been altered by our system is such that you're in and you're out, and unless you are a very sophisticated patient, it's often challenging to get all of your questions asked. And so I think she made a very important point, and I know that the American Academy of Pediatrics is looking into this, creating more opportunities for parents to fully understand why it is that vaccines are so important, and to not dismiss concerns that they may have about the safety and efficacy, but to spend the time to do so. And so part of it is ensuring that in our training, we give young doctors, middle-aged doctors, older doctors, the opportunities to practice that, because in my opinion, the way in which medicine has changed, that art has been lost. The other thing that I would say is that there was recently a large-scale study in, I believe it was the Netherlands, where hundreds of thousands of individuals were in a database looking at adverse effects. And there were relatively few, if any, serious adverse effects. We know that with any medication, there's no medication that's 100%, and we know that there are small numbers of adverse effects, but the reality is that getting measles creates more of a risk than getting the measles vaccine. 1 in 1,000 individuals may die. 1 in 20 will develop pneumonia, especially if they're under age 5, and those are the ones that are most likely to die. So it goes back to this issue of balancing risks and benefits, civic responsibility, civil liberties, and creating a process by which we can have a more just and equitable city, as well as a more healthy and well-vaccinated city. So thank you for that.
Do you want to say any more about his second question, or his first question about, okay, sorry, no.
Hi, I'm Daniel Miliseski. I'm a night student. My day job is at the City Comptroller's office. So I was recently in Israel on a tour that had nothing to do with vaccination, but the tour guide, I guess, was an anti-vaxxer. I know he felt compelled during the tour to talk about that and try to convince people on the tour of his beliefs being valid. And he brought up some points which I guess I've heard before. I don't agree with these points at all, but I don't really know how to engage with them effectively, and I'd like to be able to do so. Like he was going on about how there's heavy metals in vaccines. There's one example, and then he was suggesting, okay, there's scientific research, but, it's biased because this interest is funding the research, and, you really should check out this website, and, so how do you respond to that? Because, I want to be, I think we should engage with these people. We shouldn't say, oh, you're crazy, because that's not going to, get us to our side. So, how do we engage with them effectively? Address these points.
Yeah, no, that's a great question, and let me start off by saying that vaccine hesitancy is a geopolitical issue, right? And during this outbreak, I actually had a phone call with the Israeli health minister to say, what's going on? And, he shared with me sort of the same frustrations that we had here in terms of a very small community being infiltrated by anti-vaccine messages, and that the outbreak in Israel had actually begun when individuals had gone to Ukraine to visit. And so it's not just about, a particular guide in Israel. It could be a particular guide anywhere you go. And your point about being educated is extremely important, because I wish that more Americans were as well educated about the facts as they are about the myths and the fears. And so what we have shared with individuals is the most important thing you can do is know what the trusted sources are, and look at the information and make decisions for yourself. And so we recommend obviously going to our website, nyc.gov/health, the CDC website, the American Academy of Pediatrics website. And there is ample information there that talks about the truth and the facts. The other thing I would say is that which I didn't talk about in my remarks, but your point reminds me of this, is during this outbreak, there was a pamphlet that was developed by the anti-vaccine community that was just riddled with lies and was couched in sort of this religious context. And members of the Orthodox community took it upon themselves to go line by line, create their own pamphlet countering that misinformation. And I think that's a really telling example, a crystallized example of the importance of engaging communities and taking responsibility not only for their own individual health, but that of their community. So, great question, and thank you. That's a great one to end on.
Thank you for a really stimulating morning, and which we all learned a lot. And thank you for the work that you've done on measles and on health generally.
What was your last question going to be?
There were criminal penalties imposed initially with the order. We sued, and those criminal penalties were withdrawn. And the question was, why did you feel the need to impose criminal penalties against someone for the status of being unvaccinated, which we think violates civil liberties? And that was withdrawn, so there was an acknowledgement